Remember many years ago, it was probably 20 years ago, a woman came in, she was in her 70s, and she brought in her DEXA, showing that she had osteo. And, I kind of went through my little talk, and she looked at me and said, "Young man, I don't think you're listening to me." It's like, whoa, okay. Yeah, I don't want to
Okay, then.
stabilize this. I want my bones back. So I said, "Okay," right? And so a classic in Chinese medicine dietary stuff is pork spine, which the bones in the spine are very easy to leach the calcium out of. And the pork spine itself is very rich in a lot of other things. Now, it's hard to find here in my city because I had so many patients that were getting it. There isn't any left, right? But I was having them do pork spine, and I was having them do an eggshell calcium. And then I would recommend that they do Tai Chi, which is the single best form of exercise that I've found for hip mass.
Have you made it past menopause, or are you going through it now? I'm Dr. Pat McShane, and on the Women's Healthspan Voices podcast, I'll guide you through the health challenges of the menopausal years and beyond, guiding the way to thriving in this powerful era of your womanhood. Hello and welcome to Women's Healthspan Voices. We have a very special voice with us today. That voice is the voice of Dr. John Nieters, who is a Chinese medicine practitioner, a doctor of, I think it's still called Oriental medicine.
It
Maybe
is
you
still
can
called that, yes.
correct me
The
on
newer
that.
programs have a different name, but that's the one
Okay.
that I had.
Okay, excellent. And so Dr. Nieters has a little bit of a different, certainly a very different experience in training than as a physician that I have, and a different approach to taking care of people, women in particular. So I'm delighted to have you with us today. Thank you.
Thank you.
And Dr. John and I had an interview recently on his podcast, and I'll let him tell us a little bit more about that. But it was great fun, so I'm really looking forward to this. Just before we got on recording here, we talked about the Chinese view of menopause, and I'll let you take it from there, Doctor.
That's a great place to start. First, I want to say that since we have published the interview that we did with you, people love it. They just love it. So I hope all of your people that you talk to tune in and listen to it because it was really, really awesome.
Thank
And
you.
so, and I've taught gynecology in Chinese medical schools for decades, actually. And it's actually my favorite thing. My doctorate is in gynecological endocrinology. So I just love that. And one of the things that I was struck with very, very early on in my training was when one of my teachers said, the second spring. And it's like, and there are all these terms that you go, what does that mean? What does that mean? Right. And the thing with Chinese writing in general, but particularly the medicine, you were considered, you were not considered a good writer unless the phrasing you used had both a very solid meaning and also an esoteric meaning at the same time. So you got to kind of sort through things at first. There were many things that I heard in school that I didn't really understand the meaning of for, a decade or so afterwards. And one of those was the second spring. And that's the term that in Chinese medicine they use for menopause. In fact, when Mao came into power, Western medicine had pretty much replaced traditional Chinese medicine. There was a fellow that came to the US, a very famous doctor, and he went back and said, we need to become more modern. And they actually closed down a lot of the acupuncture and herbal medicine schools. And Mao came in and said, oh my God, we have to get them open again for practical reasons. We cannot afford Western medical drugs and pharmacy, right? And so,
Neither can we here in the
right,
West. It
exactly.
turns out, yeah.
And so I have a book called The Barefoot Doctor's Manual. And so what they did is they trained a lot of these acupuncturists, but they didn't get a lot of training. They got basic herbal training, basic pharmacological training, how to use antibiotics, et cetera, and then acupuncture. And they sent thousands of them out in the countryside to help people. And so it was a very interesting approach. But then they reopened the acupuncture colleges and built a lot of newer ones. And each of the major schools was tasked with the job of writing a textbook in their specialty. And in China, most of the hospitals are specialty hospitals. So, like in a region, for example, one person that I studied neurological problems and stroke with ran the largest stroke hospital in the entire world. And they saw, and this is a number I had to hear several times before it would sink in, they saw 10 patients a day. They built a special railroad line to drop people at this new hospital. And that's because everybody from that region that had a neurological problem, stroke, etc., went to that same hospital. And some of the value of that is you see 10,000 patients a day in a hospital, you start to see some very distinctive patterns, right? And
Yes,
so he
and you
came
get
up.
quite good at what you're doing. Yeah.
Absolutely. And that hospital had the highest recovery rate using the general scale, the Edinburgh Scandinavian scale, of any hospital in the entire world. It was just pure dumb luck that I got to study with this guy. He came over to teach in my doctoral program. I really didn't know much about him. I thank God I would have been probably scared to death, right? But I had the good fortune to study with him. But anyway, back to the second spring. And the idea is that menopause is a time of freedom, absolute freedom, right? So in China, women tend to have children at a younger age. Their diet was significantly better. It's not so significantly better now, but it has been historically. They didn't use a lot of pesticides, herbicides. They ate real food. They didn't have a lot of processed food. So women were very healthy. And by the time they got to menopause, because they had children at a younger age, they didn't have the burdens of being mothers, right? They didn't have the burdens of a monthly menstrual cycle. And in China, the retirement ages are much younger than they are here. I'm 75 and I'm still working. That would never happen in China. If you're in a medical profession, and so in Chinese medicine, going all the way back, they determined that women were on what they called 7-year cycles of growth, and men were on 8. And most of us know that women mature much more quickly than young men. And so they looked at those cycles and they said women need to retire at 55 and men need to retire at 60. And so you've got these women, no children at home. They still have loving relationships, but they're not taking care of them. They've lived a good, healthy life. They haven't been exposed to the number of xenoestrogens that women here have been exposed to, artificially kind of raise their estrogen levels, and they're retired. And I would go out when I was studying there the last time and into the parks on the weekends, and you'd see groups of 40 or 50 women doing Tai Chi or Qigong or line dancing. Line dancing was really big when I was there. And so they're getting that physical activity. They've got these large cohorts of women that they can associate with to keep their brains young, to keep everything really flowing. And again, they're doing things like Tai Chi and Qigong, which are good for their bones, good for their muscles, good for their ligaments and tendons, and probably above all, good for their brain, to have that kind of activity. And one of the things that you said when I was interviewing you that I tell all my patients now, and you'd gone through all the things that you felt were important for an aging female population. And then I said, what's the one thing, the most important thing? And you said frailty. Don't become frail, right? And so that really stuck with me. And not that I didn't talk to my patients about that, but now it's become even more important to me. You've got to keep your muscles strong. You've got to keep moving. You've got to keep your brain moving, etc. And so over there, it's a second spring. You're out having the time of your life, whereas here, unfortunately, we don't have that same relationship.
No, no. For many of us, it's a time of greater isolation, loneliness, physical inactivity, loss of roles, our sense of self, so many things we lose when we lose that work relationship too. So,
Absolutely. Yeah, it scares me when my patients say, I'm going to retire. And I said, oh, what are you going to do when you retire? And they go, what do you mean I'm going to retire? I said, no, you don't get to retire unless you're going to, and I find this is even harder for men. They don't form as many close relationships. And if I'm talking to a guy and he doesn't have a plan, like you're going to work at the Railroad Museum, I don't care what your plan is, but you need to not become isolated, right? You've got to have some cohort, some group of people that you actually communicate with. Yeah.
Absolutely. Yeah. The other thing we talked about a little bit was the Chinese theory of aging. And I know you covered some of that about the 7-year cycles, but maybe you could tell us a little bit more.
Well, I will definitely tell you more, and we could do a couple of shows just on this topic. So in Western medicine, when you're looking at cardiology, there's new stuff that comes along, but, it's kind of it hasn't changed all that much in the last 20, 30 years, right? The ideas are kind of the same. And there's a book by Malcolm Kendrick called The Clot Thickens. And I really like the book because it's kind of swinging around more to Chinese medical ideas of aging and blood stasis, right? The thickening of blood, the higher the viscosity levels becoming thicker, which takes more energy, more blood pressure, et cetera, to move
To
the blood,
pump
right?
it. Yep.
Yeah, to pump it. I mean, because, I think it was Tom Cowan. I was reading one of his books called Cosmic Heart. And there's things that but then suddenly you go, oh my God, that's so obvious. And he said, you go ask a hydraulic engineer and ask them if this little tiny pump called a heart can by itself move this semi-viscous liquid through 70,000 miles of blood vessels. And it's like, well, no, of course not. So you need the arteries doing their job, right? It's a symphony of activity to get that blood moving. And the thicker it is, or the more clotted it is in some ways, then the harder it is. And so the Chinese have been hot on that for at least 1,800 years. About 150 years ago, there was a fellow named Wang Qing Ren who really, really dove into it. And then more recently, there was a doctor, his name, Yan Dexin, who wrote a book called Aging and Blood Stasis. And he points out that the proximate cause of most death is blood stasis, where the blood isn't getting where it needs to go. I mean, for example, and he points out that with diabetes, people don't die directly of high blood sugars. The high blood sugars cause the blood to get sticky. And if you see a visual of blood going through the small vessels of the eye, it's not like a torrent. Those red blood cells are going bloom, bloom. Well, and the red blood cells have to fold up almost like a pizza pie to get through those tiny vessels. Well, if two of them get stuck together, which is what happens with glycosylated hemoglobin, right? That's why we measure hemoglobin A1C to see how much thick sugar coating is on the red blood cells. Well, they become like candy apples where they get stuck together and they literally can't fit. And that's why you get so much eye disease and blindness, why you get kidney disease because those vessels are tiny, why you get peripheral vascular disease. So he really goes into depth about in cardiology, right? How the blood can't circulate properly through the vessels of the heart. And that's one form of blood stasis. And so that is what we consider the proximate cause of aging and really of most death. Now, one of the things that's fascinating when I have time to talk to a doctor about this. At first, they're kind of, that's weird. But once they start hearing it, in Chinese medicine, there's this concept of guiding herbs. For example, this Wang Qingren came up with a formula called Shui Fu Juyu Tong, which means basically removing stasis in the mansion of blood, which is the heart and somewhat the lungs. And so that was his basic formula. It's an amazing formula. I have so many patients that have had different types of cardiology problems, not rhythm problems, but plaque problems, things like that, or just a weakened heart, a lowered ejection fraction.
Valvular disease or
Yeah,
congestive heart failure. Yeah.
exactly. And this formula is right at the core of the treatment principles for treating that. Well, then if you change just a couple of the herbs, you get a formula called Gusha Juyusan, which is basically moving the blood below the diaphragm. So we use that for liver problems a lot, the gallbladder problems. Then you change a couple of other herbs and you get a formula called Shaofu Juyu Tong. And that's to treat problems in what the Chinese call the lower jiao. So that's the uterus, the bladder, things like that. Then you change a couple of other herbs. And I know this sounds kind of strange, but you change a couple and you get something called Shentong Juyu Tong, which is basically getting rid of pain in the body, is what the name really probably most closely translates as. And we use that for spinal stenosis, for example, but also for some pain syndromes. Then change a couple more herbs, and you get something called Tongshao Boshui Tong, which is call it opening the brain, blood invigorating, and we use those for things like concussion. And so by just changing a couple of herbs, you change the directionality. Now, that's not a concept that's really thought of much with Western pharmacology, but I'll tell
No.
you, I've been doing this a long time and it really works. It's just, in fact, I tell students, it's like, okay, you've got all these blood moving formulas. If you just remember this one teacher's blood moving formulas, you pretty well got it handled. And yeah, so such a different world, a different concept.
Uh-huh. So that theory of aging is what you bring to the consult room or the
Absolutely.
treatment space with your older patients, and
Even my younger patients, because
even, well,
I
certainly
don't
your
want them to
younger.
go get that point, right?
You want them to be your older patients in 20 years. Yeah.
Well, I just
Yeah.
had my 75th birthday a couple weeks ago, and one of my patients said, "Listen to the Toby Keith song, 'Don't Let the Old Man In.'" And that was really like, yeah, don't even go there, right? Keep yourself young.
Yes, exactly. That's what this whole podcast is all about. So maybe shifting gears a little bit, you could tell us the story of your mother and kind of how some of these principles of keeping everything going as well as possible down the road might work for an individual
Well, and
woman.
again was really struck by your talk when I was interviewing you about frailty, and it really applied to my mom's. Now, she was an inveterate smoker, and that, of course, really contributed to her demise. But we also talked about the fact that a lot of times older patients, particularly female patients, aren't necessarily given the attention that they need, to deal with their particular problems. And that was exactly the case with my mom. My mom had some emotional problems when she was younger, and I guess I was about 25. She moved in with my brother and my sister to live with me, and she was taking about 40 pills a day and tons of stuff. Within about a year and a half, we were able to get her down to 1 pill a day, and that one was absolutely critical, but she felt better than she'd probably felt in her entire life, and she was active. She was cooking. She loved cooking. And so she cooked for us. And she was active. She would walk down to the market rather than driving. And it was just a really wonderful time. Well, a few years later, she moved down to live with my brother in Santa Cruz. And she was seeing, some doctors down there, but not gerontologists, just, GPs. And within a few months, they had her back up to about 40 pills a day. And one of the problems is they were over treating what they thought was high blood pressure. So she had a series, and I find that with older patients, this is not uncommon. They've had high blood pressure and they're put on medication and they don't have high blood pressure anymore. They have low blood pressure and they'll just pass out. And that's what happened to my mom. And
Fall. Yeah.
yeah, a fall. Yeah. And she fell a couple times, but they still didn't change her medication. And I wasn't close enough to kind of be hands on to monitor it. And she fell and fractured her hip. And as you know, that's, a great percentage of people, women particularly, that break a hip, never leave the hospital again. And so she was put in assisted living. Now, she had a do not resuscitate message because her ribs were so fragile. She'd been stopped being active. She had stopped walking. And so she passed away in the assisted living facility. And really, it was really the frailty of which you speak because she kept getting more and more frail and nobody was doing anything to help her with that.
Yep.
So,
And the many medication situation is very, very prevalent in this country and probably throughout the Western world. And often the symptoms that people have and a kind of general lack of energy is a side effect of one or more of the medications that they are on. And I did a whole podcast recently about too many medications and looking at the list and seeing what could be whittled down. And it's tough because half these medicines are prescribed by a certain, specialty practitioner and a couple maybe by your primary care. And your primary isn't keen to take away the things that the specialists may have given you, but that could have been 6 months or a year ago, so it compounds itself. And pretty soon the average person over 65 in this country is on 5 or more medications. So
Yeah.
all with side effects, and dizziness and lack blood pressure when you rise is the side effect of some of them. So
Yeah,
yeah,
absolutely. I
yeah.
had a couple patients, a couple that I was seeing, and one of them said, "Can I bring my dad in to see you? He's really, he's having a hard time. He gets really dizzy," and just a whole list of problems. I said, "Yeah, sure." And so before I even got here, I was reading his medical chart, and in the chart, and I don't remember the specific numbers, but his last visit, his blood pressure was extremely low. His systolic was like 75 or 80. It was very low. And, he came in, I felt his pulses. I could barely detect them. And I said to the daughter who was with him, "I think you should go back to his doctor and point out the fact that his blood pressure was so low. And that's one of the reasons I think he's having problems." Well, she did. And the doctor actually got mad. It was a nurse actually that was doing it, and said, "Well, how would you know if his blood pressure was so low? You had an acupuncturist check it? What do they know?" And she said, "No, here I've circled where you took his blood pressure the last time he was here." And sure enough, they took him off those meds. He was a completely different person. I mean, if you don't get oxygen to your brain, it's hard to think, right?
Yes. Yeah. And again, in a prior discussion, you've described some folks who come in their 60s barely able to function, and others in their 80s who I think you described one of your female patients as being a PE teacher who could still probably
Oh, yeah.
teach PE.
She's 95 and she runs circles around people, and her brain, physically, that's awesome, but she is sharp, boy, I'll tell you. She's like, she'll look at me like, "Are you sure about that?" And she's just like, "Whoa." And I've got another patient that's 99 that's still doing well. And, as you mentioned, I have patients in their 30s and 40s that are actually starting into frailty already when they show up here. And getting them to move, is critical. One of my favorite tools now are the vibrating plates, right?
Hmm.
And I had read decades ago when the Russian cosmonauts came back from being weightless. So you'd lose bone mass, you'd lose muscle mass, and they would put them on a very sophisticated, of course, vibrating plate. And they would recover dramatically faster than our astronauts because that plate stimulated them. You can't move quickly enough to keep it from exercising you, I like to say. So I'll talk people into doing that. We'll do some dietary changes and then get them moving, right? Walking is great. I also want them to do some weightlifting. I find that's just so critical for an aging population, is keeping particularly your thighs strong so you can bounce up out of the chair, but again, keeping everything strong. And I find that of all the things I recommend, and I'll do herbs or supplements, etc., but of all the things that I recommend, I think what gives them the most value is if they will start doing a bit of intense training. And it doesn't have to be a lot. 15, 20 minutes a few times a week is the difference between being in assisted living when you're 80 or being out running around having fun with your grandkids, right?
Yeah. Yep. And protein too, do you find that's
Yeah.
an issue? Yes.
Yeah. The two things that I really with diet that I harp on a bit are protein, because I find most people, and particularly older people, just don't get enough protein. And so, and we think of protein as building muscle, which that's handy, but also we've got all these amino acids that are creating your neurotransmitters and your hormones and things. So, getting enough protein in people. In fact, doctor, I learned years ago that if I suggest something, sometimes people will do it. So behind me, I have a whole shelf of show and tell, right? Like some people, I will want to do baking soda, right? For their kidneys or for GERD or something. So I have a little jar of baking soda. Other patients, I'll want to do some apple cider vinegar. So I have an apple cider vinegar with pomegranate juice. And so I'll pull these things out. So in the other room, we have a vibrating plate so that people can, this is how it is. Here, put your feet on it for a minute, sit down, and I'll turn it on, and you can see what that feels like. So I found that the show and tell really, really helps. So, yeah.
Maybe shifting gears over to talk about osteoporosis per
Uh-huh.
se, which may not be something that people know that they have even, but many of us actually do have either osteopenia, low bone density, or very severe loss of bone density, osteoporosis. Maybe you could tell us a little bit about how you approach that in your senior female population.
Yeah, and like I said, I had my 75th birthday recently, and so my view on things changes subtly over time. Hopefully, it expands. Hopefully, I get a little bit wiser. So my menu for that has gone up a lot. And so I remember many years ago, it was probably 20 years ago, a woman came in. She was in her 70s, and she brought in her DEXA, showing that she had osteo. And I kind of went through my little talk, and she looked at me and said, "Young man, I don't think you're listening to me." It's like, whoa, okay. Yet I don't want to
Okay, then.
stabilize this. I want my bones back. So I said, okay, right? And so a classic in Chinese medicine dietary stuff is pork spine, which the bones in the spine are very easy to leach the calcium out of. And the pork spine itself is very rich in a lot of other things. Now, it's hard to find here in my city because I had so many patients that were getting it. There isn't any left, right? But I was having them do pork spine, and I was having them do an eggshell calcium. And then I would recommend that they do Tai Chi, which is the single best form of exercise that I've found for hip mass. It doesn't do anything for the spine because you're holding your spine erect, but the angle of the pelvis and the legs puts more stress on the hips if you're doing it properly. And so it really helps build bone mass in the hips. But again, not so good for the spine or for the wrist. So I said, do Tai Chi one day, do yoga the next day. And then third day, do some weight training and just kind of mix it up like that. And in her case, I gave her some herbs and supplements, and she came back 2 years later with her DEXA, and she was no longer osteoporotic, right? But she did everything exactly that I suggested that I think she was the first person that actually followed my suggestions all the way down the line. And she was doing bone broth, which she would put in ice cubes trays and freeze them, and then she'd just pull them out like they were bouillon. Well, now I've for me, the thing that makes the biggest difference, all of those I still recommend, including the vibrating plate. But the biggest difference is I'm using a lot more vitamin K. And as you know, vitamin K2 activates matrix GLA protein to pull the calcium out of your soft tissues where you don't want it, like your heart. And it activates osteocalcin to put it in the bones and the teeth where you do want it. And I find that has been astonishing. So I use vitamin D. I'll give them food for calcium, like the bone, spine bone, and then vitamin K2. And and I was doing it mostly for bone health. But what I found is I would have patients that had a coronary calcium score done, and then they would follow this for a year, and their coronary calcium scores would go down, right? Into a much more, it's like the best of all worlds, right?
Yep. Taking the bone where you don't want it and moving it to where you do want it. Yes,
Yeah, exactly.
yes.
I read a book called, actually, I don't remember the name of it. It's called Vitamin K2 and the Calcium Paradox. And so I tend to mark, pages. I put lots of little tabs in there. And so I thought I knew something about vitamin K2. She totally disabused me of that notion. I probably got 50 markers in here of things I didn't know before I read this book. And I'll tell you, that really turned things around. I was already getting pretty good success, but that made a world of difference. So
Well, that's good to know. Thank you for that.
you're so welcome. And that's one of the reasons I feel so blessed to be living at this moment. I mean, for lots of reasons, but that I get to practice the principles of functional medicine and do some very cool lab tests. And you see things there that are like, oh my God, of course. And then to do Chinese medicine because we see things that Western medicine doesn't see because they're not looking for it, right?
Hmm.
It's like I did a podcast on bedside diagnosis and the 10 or so things that I look at on people's fingers and hands looking for problems with cardiovascular risk, right? And so the biggies in Chinese medicine are pulse diagnosis, where we are feeling the radial artery at several different positions, right? Several positions on each arm, and there are 28 pulses, qualities that you can feel. And so and you're feeling it superficial, intermediate, and a deeper level. So the matrix is huge of terms of the things that you can feel in those pulses. For example, I mean, really obvious ones. If a patient doesn't tell me anything and I sit down to take their pulse, I'll know if they have POTS immediately. POTS
Hmm.
pulses are so easy to feel. And there are a variety of other things that you can feel. But also tongue diagnosis. And that was something I have a textbook, Western medicine from the 80s, and they were doing a lot of tongue diagnosis, right? They didn't have the labs that we have now, they didn't have the machines, so they had not become so reliant on technology and were really more dependent on their bedside diagnostics. And it talks in there about a tongue diagnosis, looking at the shape, at the color, at the coating on the tongue. But the
Hmm.
most important piece of that for me are the sublingual veins, the 2 veins that run up along the underside of the tongue. And my mom used to say, "The eyes are the windows to the soul, Johnny." And to me, those veins are the windows into the cardiovascular system. You can tell how sticky people's blood is by looking at those veins. So ideally, you don't even want to be able to see them. And sometimes you'll see people, it looks like 2 big purple earthworms under there. And those people are at a lot of danger for stroke or heart attack in a very short period of time because their blood isn't moving properly. So, and
Back
again,
to
we
the
have,
stasis diagnosis, the blood stasis
yeah,
diagnosis. Yeah.
absolutely.
I've heard I've heard eye doctors say similar things about, but they have sophisticated equipment at this point, but
Yeah.
they're seeing the vascular system at a level that's novel in human medicine. So,
Yeah, I had a
um,
patient a couple days ago talking about her discussion with her eye doctor, where he went into
mhm,
great detail about that and actually gave her some very good ideas about what to do about it in terms of making her blood less sticky. And he was using the idea of proteolytic enzymes like nattokinase, which, you could write a 500-page book on it, but basically the way I look at it, it's almost like putting a Teflon coating on your red blood cells so they don't stick together. And he told her in her case, to also start using serapeptase, which is just kind of a magical proteolytic enzyme that will break down dead protein like fibrin deposits, but it will not damage living protein. It's the most amazing substance. It's what silkworms use to burn themselves out of their cocoons. And, we know that silk is much stronger by weight than steel even. And so if the enzyme worked on living tissue, it would kill the caterpillar. But living and working on dead tissue, it lets them burn themselves out of the cocoon. Now, I don't know who in the world thought of applying that to human beings, but it's pretty astonishing. And so the doctor was right on, just absolutely.
yep, yep. Anything else that you would wish to tell our older female audience? We've talked about activity and a little bit about diet. We've talked about a little bit, certainly about protein, and anything else that you would recommend
Well,
in general that you have noticed.
going back to the diet, so I talked protein, I think is so critical, and most Americans, particularly older Americans, don't get enough protein for their weight, but also fiber. We are a very
Yep.
fiber deficient country.
Yes. Yes.
I remember years ago, I don't know if these numbers are still adequate, but at that time, the Chinese population was averaging about 35 grams of fiber a day, and the average American, now we got to take into account that the great Midwest, they don't get much fiber, but the average intake was 10 or 11 grams a
Yeah.
day.
That's what I've been seeing as well, even currently.
Yeah, okay, good, or bad, sorry. And so, in China, they're having typically 3 bowel movements a day, 2 or 3, and here I'll have patients come in, and I say, "Do you have a bowel movement every day?" And they go, "Every day? My God, no, once a week." I said, "Oh my God." And of course, colorectal cancer here is about 10 times higher than it is in China. right? And so
Even in very young people nowadays, in their 30s. Yeah.
it's an epidemic now in
Yes.
young people. In fact, I had 4 young, I call them young, 40-year-old, approximately, women come in for treatment. So we get a lot of referrals from major hospitals around here for their patients that are going through chemotherapy. Because if you do acupuncture while you're getting chemotherapy, it'll almost 100% of the time prevent you from getting neuropathy. And so the hospitals here, like UCSF, major teaching hospitals, have realized that. And so they'll refer patients over here. And I got 4 colorectal female patients around 40 years old in 1 month. That's just scary and unheard of.
So sad. Yes.
Yeah.
Yep.
Yeah.
Yep.
So fiber and protein are the 2 biggies. And so I think if you're getting those, the rest of it kind of will, come around. I mean, obviously avoid the worst stuff, cut down on your sugar. But I find if people get enough protein and fiber, they're not drawn to junk food as much, right? And I'll tell people, eat defensively, right? You like eggs? Take a hard-boiled egg with you, kind of thing. They've now got kefirs that have, I get one that has 30 grams of protein in it, right? And it's quite tasty and it's not that expensive. So, yeah, I think those are really huge. One thing I just want to say about Chinese medicine in general. So, we hear these terms yin and yang, right? And I think they're very much misunderstood. And I always use the example of Einstein when he said E equals mc squared, right? So energy equals mass times the speed of light squared. And that's really how we look at it in Chinese medicine. There's no absolute yang and there's no absolute yin. It's an interplay between them, right? And so you want the balance there. And so the yin is the more substantial, your bones, your blood, your muscles, and the yang is the more energetic piece of it. But they're always in play with each other, the functional and the physiological. And looking at that balance, I think, is a really, really important thing, particularly as we age, because people tend to become more yin deficient. Their tissues start to break down, they lose bone mass, but they also become often more yang deficient and they just don't want to move. You know, it's like my older male patients when their testosterone starts, plummeting. It's like when you're 30 and you have a great idea, you go, "Oh, yeah, that's a great idea. Let's go do it." And when you're 60, you go, "Oh, that's a great idea. I'm too tired." Right? You just sit
I
back down.
wonder if anyone else has done this already.
Right? Exactly. So, right? So to us, it's all about balance. And when I hear you speak, that's what I hear also, is it's really about balance.
Yeah.
You don't want to overexercise, but you need to move. It's all an interplay.
Yes, or go crazy with counting grams of protein
My,
or
I was so
carbs
happy.
or yeah.
I was so happy. I found a research article just a couple weeks ago where they compared Mediterranean diet with a FODMAPs diet. Now, as you
Mhm.
know, FODMAPs, nobody can keep that up for very long. You're eliminating pretty much everything to taste good. And they said that the Mediterranean diet outperformed FODMAPs for irritable bowel disease. I was so happy to see that.
Yes, we should just all go on a Mediterranean diet and a little bit more plant protein if you're a vegetarian, a little bit less. Yeah, yeah,
Yeah, absolutely.
yeah.
I was doing a program where I was watching a couple of neurologists whose specialty is dementia, and they said they feel the best food to prevent dementia and frailty actually are sardines, right? With the bones in and the skin on. And I was so excited. And then I remember my wife will throw me out of the house if I open a can of sardines.
Well, you'll have to eat that at the office.
Yeah, I eat it when she's not around, and then I carefully bag it up and carry it out to the garbage.
Another thing I'm hearing that, bears a little bit of attention is that if a woman or a person is not happy with the answers that they're getting from their doc, who's so busy oftentimes, that they might get a second opinion from a functional medicine practitioner or an acupuncturist, such as yourself, with a different viewpoint.
Yeah,
If they've hit a brick wall and they can't make it around, or as a primary practitioner for that matter.
and because of that need, in my opinion, I do several 15-minute discovery calls during the week where people don't know where to go. It's like, do I go to a medical doctor? Do I go to PT? Do I go to an acupuncturist? So I just listen to them for about 15 minutes and give them recommendations. And it's really been great since I've been doing that, how appreciative people are. And it kind of gets them over that inertia. It's like, no, you don't need to go see an eye doctor, right? Right? That's not something I can help you with, really.
Yes, yes. And as you said, we're so lucky to live in the current era where there's so many resources, sometimes too many resources, as you mentioned. What are we really doing here? But this is a good problem to have.
Yeah. And one of the things that I remind my patients, because they will get frustrated sometimes with their medical doctors, and I'll say, you know, this one doctor I know in town, he's a really, really good doctor. I love his recommendations. And he told one of my patients that has a caseload of 1,500 patients. And he pointed out that in Cuba, they have a caseload of about 100 patients. So so overwork our doctors here. And, they have limitations. They're people. And so if you can avail yourself to other sources, that's awesome.
Yes. And there's pretty good data about some, like diabetes being the one that comes immediately to mind, that the more often the person sees their practitioner, the better they do, the fewer complications they have. But that can be difficult with our insurance system and just the time that it takes, and the practitioners may not have that time available for you.
Well, I love when patients will, if they have the means to do so, can hire a health coach.
Mhm.
I used to do a lot of more health coaching, but now I just don't have the time, energy to do that as much. And so if they hire, I find that my patients that will work with a health coach, their health is dramatically better because, we all do better if we have someone else to hold us accountable.
Yep. Or for some people, their smartphone or their watch, whether it's their glucose or their activity or their heart rate, So we have a lot of tools out there now.
Yeah.
So
So
good
thank you.
for us.
You're
Okay,
fun
this
to
has
talk
been
to.
really fun. I've really, really enjoyed it. Thank you so much. And as always, our goal here is to have uh, everyone who's listening to this, but certainly our senior women population, explore ways to have the longest, healthiest lifespan that you can. And thank you, Dr. John, for your contribution to us learning more about that today. So
Well,
thank you, everybody.
thank you so much for having me on. I just really enjoy speaking with you.
What? Oh, one more thing. What is the name of your podcast so people
The
can?
best one is probably thebalancingpoint.net,
Okay,
thebalancingpoint.net. And we're on
great.
all the, Spotify, all those other
The
sites.
usual
That's
suspects. Yeah,
Yeah,
yeah.
exactly. All right.
Right. Thank you
Thank
so
you.
much. Take good care.
Okay.
Thanks for listening to the Women's Health Span Voices podcast. If today's episode spoke to you, follow the show and share it with a friend ready to take charge of her health. And please leave a review. It helps more women find us.